Confident, good morning. Please give us a moment to live stream on Governor Leon Guerrero's Facebook page. Good morning. Please give us a moment to live. Hafide and good morning. Thank you for joining us for Data with Dr. Ann. And as you can see, it looks a little different this week. I'd like to go ahead and introduce myself. I'm Crystal Paco San Agustin, Director of Communications at the Office of the Governor of Guam. And I also in the room today, we have Governor Leon Guerrero, as well as Lieutenant Governor Josh Tenorio. We have our Public Health Director, Arthur San Agustin, as well as our Public Health Deputy Director, Ms. Lori Duenas. And of course, this is her show, Territorial Epidemiologist, Dr. Ann Pabutsky, of course, from Public Health. We have our Interim Chief Medical Officer, Dr. Robert Leon Guerrero, also from Public Health. We have our COVID-19 Incident Commander, Fernando Esteves from Public Health. And last but not least, we have our Senior Epidemiologist for the State Epidemiology Outcomes Working Group, and that's Dr. Annette David. And without further ado, I'm going to go ahead and give the floor to Dr. Ann. Of course, this is Data with Dr. Ann.
Okay, good morning. The trends for today are from the 1st of January through Monday, February 28th. And as you can see, Guam is looking really good. Our 7-day rolling average of cases is now less than 250 per day by the end of February. And that's really looking good because we were in the 800s back in January and part of early February. As you know, the testing for any reason at all was ended on January 25th. And so we have seen a decrease in testing. And the 7-day rolling average for testing is about 1,000 tests per day now. But our test positivity rate has gone down from about 40% in mid-February down to about 23%. All age groups are showing a decline, which is great. Symptomatic cases are now averaging less than 40% of cases. And we're finally now seeing a decrease in the hospitalizations and census count for COVID cases in the hospital since mid-February. There's also decline in the ICU. Deaths continue to appear sporadically. We've been averaging about 1 per day, but even that has abated somewhat. And so Guam is looking really good. We hope we're entering into some kind of endemic stage, but we don't know what's going to happen with other possible variants. And what public health will continue to do is monitor the situation. We're still at about 200 plus cases per day. So we're not out of this yet. That's it from me.
Thank you, Dr. Ann. I want to give the floor now to, of course, Dr. Annette David.
Thank you so much, Crystal. Good morning, Governor, Lieutenant Governor, and friends. I hope you can see my screen. I'd like to begin where Dr. Ann left off by emphasizing that the pandemic is not yet over. Our trend lines are looking much better, but there is still a lot to be done. Last Friday, the Centers for Disease Control and Prevention issued a new set of metrics to help guide community actions in responding to the COVID pandemic. And what I'd like to do is very briefly go over these metrics with you and also show you our calculations that indicate where Guam is. So just a bit of background to explain why there was this change, and then let's go over what the metrics are and what the implications are for action. So you will recall back in September 2020, the CDC released a set of indicators of community transmission, which were the basis for policy and program actions to mitigate the COVID pandemic. So at that time, they were recommending that we look at two metrics. The first being the total new cases per 100,000 persons in the past 7 days. So the incidence, new cases. And the second, looking at the percent of tests that are positive in the past 7 days. These were used to inform setting specific guidance and layered prevention strategies, including screening, testing, masking, physical distancing, and so on and so forth. And public health practitioners, as well as schools, businesses, and community organizations, relied on these metrics to inform decisions about prevention measures. But things have changed, and in mainly in three ways. The first is higher immunity. So right now we have higher levels of population immunity that have arisen because of our good vaccination coverage, and also because of the increase in numbers of people who have had the infection and recovered. We know that high levels of immunity reduce the risk of severe outcomes. The second change is now the availability of more public health tools, including vaccines to prevent severe disease, therapeutics, as this would include the monoclonal antibodies and the antivirals, and home testing, and widely available testing. And finally, and I think importantly, we have, I think, as a consensus, as a nation, come to a consensus that we need to shift our focus from stopping transmission to minimizing the impact of severe illness on health and society. And so, because of this, the CDC has come up with a modified proposed framework for monitoring and prevention. This framework has three components, three separate components. And firstly, what we have is the vaccination coverage. So this is a set of indicators and measures that look at the overall percent of the population who have been vaccinated and boosted, and also looking at the coverage among people who are at increased risk of severe illness and health inequity. And in particular, here we're looking at the elderly. These measures inform our vaccine activities. There's a second set of indicators, which is the focus of today's presentation, and these are the COVID-19 community indicators, which, as I mentioned in the past, really focus on just new cases and percent positivity. Now they have been changed to look at still the new cases, which would indicate transmission levels, but also factoring in the demand on the healthcare system. And these indicators will inform the prevention measures that we have been supporting, including masking, testing, and other individual and community level prevention strategies. Finally, there is another set of local metrics and information that provide local context that will help to inform local decisions. And some of these local metrics include the circulating novel variants of concern. And we know from recent data that BA.2, Omicron, is now the predominant strain, and other local information that are important to factor in when making decisions. So three separate sets of indicators that will inform actions in three different spheres of mitigation. So let's focus on the middle part, the community indicators, which is where the change has happened. It's a two-step process, and where the step one is where we decide where we are in terms of transmission. And the cutoff here is 200. If we have 200 or more new cases per 100,000 population over the past 7 days, we are categorized as being in the high transmission category. And if it goes below 200 per 100,000 population, we then move to the low risk category. Once we decide that, we then look at the two measures on demand on health system capacity. And here we look at new hospital admissions per 100,000 people over the past 7 days, as well as the percentage of staffed inpatient beds occupied by COVID admissions. So we no longer are going to be factoring in here the test positivity rate. So that is the major change. So this is the specifics of all of those metrics. So step one, you determine where you fall under new cases, and step two, you look at the two hospital or healthcare system indicators, and you'll notice that when new cases are high, the hospital indicators can be either moderate or high. There's no low risk. But once you move to the lower new case transmission category, you can then have either a low, a medium, or a high risk. For the healthcare system indicators, the community level is determined by the higher value of the two. So where is Guam? So we look at the two-step process. First, we look at transmission, and when we calculated it, as of today, we are still in the high category, 994 new cases per 100,000 over the past 7 days. And then based on that, we then look at the demand on the healthcare system capacity, and we are still at the high level for the new hospital admissions at 21 per 100,000. But if you look at the percent of staff inpatient beds, at that point, we are in the moderate risk level. But because it's the higher of the two, we still go with the high risk because our hospital admissions are still in that category. Very importantly, I want to share with you when we did the initial calculations this Monday, our transmission rate was at over 1,100. And our hospital admissions were up at around 28 per 100,000, and the percent of staff inpatient beds was over 10%. So within the span of 4 days, we have seen a decrease in all of these numbers. So these will help to inform our recommendations. And if you look at where Guam is, like I say, step one, we are still in the high risk category in terms of our COVID admissions and our staffed inpatient beds. One is moderate, the other one is high, but we go by the higher one. And so we are still at high risk, but trending downwards. So how do we put this all together? Looking at the entire framework in terms of the vaccination data, our overall coverage of our population is high. We are at over 87% of our population fully vaccinated. And the coverage among those at high risk, the elderly, is also very high at over 90%. We must continue our vaccine outreach and vaccination clinics and booster campaigns, but based on our good metrics, the governor has decided to discontinue the requirement for proof of vaccination for indoor places, and that is justified by our vaccination data. Moving to the second piece, we are still at high in terms of new cases and still at high in terms of demand for the hospital capacity. But we have seen over the past 4 days a continued improvement in both of these indicators. And so these numbers will help to guide when we begin to start lifting sequentially the prevention measures that we have in place. And then, of course, we continue to look at the local metrics to inform our local decisions. So just overall, as a summary, vaccination still remains the leading public health prevention strategy to prevent severe disease and death from COVID-19. And we know that people who are up to date on their vaccinations and who are boosted have a much lower risk of illness and death, and therefore provide a much lower health burden on our healthcare system. So our vaccination coverage has helped to guide our decision on being able to now remove the requirement for proof of vaccination for indoor places. When it comes to the other individual preventive measures, we are keeping an eye on the indicators that look at community risk, So really looking at the new cases transmission and looking also at the demand on the healthcare system capacity. And we continue to emphasize that if people choose to continue to wear the mask and continue to physical distance, that they should be encouraged to do so. But it looks encouraging when you look at the data presented by Dr. Ann and by the data on these new metrics. It looks like it's encouraging because we are continuing to improve in all of these indicators. And so we may be able to reduce the restrictions pretty soon. And that's all I have from my end. Over to you, Crystal. Thank you.
Thank you so much, Dr. David. I now want to give the floor to Governor Lilian Guerrero.
Thank you very much, Crystal. And I just wanted to thank Dr. Ann and also Dr. Annette for, again, keeping our public and, of course, through media, having to report some of the advancements that we have made. And as you know, Dr. David just presented the CDC new guidelines and how we fare to that CDC guidelines. I cannot express my thanks to you, the people of Guam, enough. We are here today because of our collective commitment to beating not just one, not just two, but 4 COVID surges. And as you know, the Omicron variant has tested us. It has taken people's lives from us, but it has not defeated us. And like the rest of the nation, as you have seen, we are seeing a decline in new COVID cases, in admissions, and also in its impact to the hospital system. We had peaked at one time at 850 cases in a single day. But as you can see with Dr. Babitsky's information, we continue to decline, and now we're seeing about less than 250 new cases per day. We are also looking really good in our hospital situation. The numbers are very promising. Today, as was reported, there are 33 COVID admissions in all of the 3 hospitals, and only 3 are in ICU and 1 on the ventilator. Again, this data is very promising and encouraging, and I don't think it happened by accident. We are beating the surge because of our people. Our people, you have made it happen. And I thank you for adjusting your personal behavior, even when it was a bit inconvenient to you. But you did it to protect our most vulnerable people in our community, as you have many times before. I know and I trust that as we continue to fight against this disease, you will continue to be vigilant. And I know our community can count on you to do the right thing. That is why also, as we see our data, again, guided by science, I have begun to slowly and gradually lift restrictions, and evident by last week, where I removed the requirement for proof of vaccination for those entering restaurants, bars, gyms, theaters, and similar establishments. Again, after consulting with our experts, our public health experts, our hospital leaders, the physician advisory group, our surgeon cell, I think we are ready to do, again, some lifting of restrictions. So what I'm going to sign an executive order that will lift social gathering restrictions, although we will still have it limited, but we will lift it from 75 gathering, or sorry, from 25 gathering limits to now 100 people in indoor dining. And this will be effective tomorrow, March 4th at 6 p.m. That means indoor and outdoor social gatherings will be capped at 100%. or sorry, 100 people, regardless of your vaccination status. And again, as you have heard from both Dr. Ann and Dr. David, we are not yet out of the woods. We cannot let our guards down. We cannot be complacent. We have more work to do together to, again, as Dr. David has said, move us from a pandemic to an endemic. For those of you who have lifted your sleeves, rolled them up, and got your shots, I thank you. We continue to urge everyone again to be boosted, to be vaccinated. I continue to say, wear your mask, wash your hands, and watch your distance. I know that this may sound very tiring, but it cannot be overly repeated. It has to be repeated because we know these are the public health measures, very basic preventive measures that has saved us and has continued to bring us to where we are today. My goal, your goal, our whole community goal is to move into more normalcy of living. And we cannot do this if we become complacent. I asked you for your continued vigilance, and I ask you for your continued cooperation. And I ask you again to listen to our public health experts, our doctors, and our community leaders. Again, we will continue to monitor our situation. We will continue to provide you information, and we will always be there to support you in any way we can. We have, since the very beginning, been very strategic and very scientific in our actions and our decisions. And that is why we are here today. Safe. I'm very disheartened and very sad for the more than 350 lives that have passed on because of COVID. But in the beginning, when we were looking at data and models, there was a prediction that if we did nothing, that if we didn't act aggressively, if we didn't adjust flexibly, if we didn't work together with the community and our experts, and if we didn't follow science and data, we would stand to lose 3,000 lives. Losing one is one too many, but we have gotten to where we are today and have contained our virus because of you again. So I really thank you. And as we near the 2-year anniversary of this pandemic, and as many of our families enter our spiritual season of Lent, we pray for those we have lost and for the strength to rise again. Thank you, and Sidos Masi. Guess we're open for questions now, Crystal?
Correct, Governor. We'll start with the Guam Daily Post. Guam Daily Post, do you have any questions for Governor Leon Guerrero or any members of our panel? I can circle back to
Yes,
you.
good morning. Good morning, Crystal. Governor,
Hi, Heidi.
based on Dr. David's presentation, at what point will you be deciding to lift the mask mandate?
As I have always said, my goal is to go back to normal behavior, normal life, some kind of normalcy. So lifting the mask restrictions or mandate, Heidi, is going to be very dependent on what our data shows us. And it is very promising. As you see, over the last couple of weeks, 3 weeks, we have been seeing a decline in all of our admissions, our hospital admissions, the severity of illness. And I'm very hopeful that in the very near future, these numbers will be maintained. And as they are maintained and we get into very low risk area, that is when I would start considering lifting of masks.
Governor, recently, Dr. Berg, the chairman of the Physicians Advisory Group, said it could be lifted in about 2 weeks. I mean, he gave a specific timeline, but what about you, Governor? Do you think it would happen before the end of this month?
In terms of the lifting of the mask, I think 2 weeks may be too soon, because what we normally do is we lift restrictions, Heidi, and then we monitor it. And if the data does show that, within the 2 weeks, we're looking at the low end, in my gradual and strategic actions, I will not lift it totally, but I would probably look at lifting mask mandates in certain circumstances and certain situations. I think Dr. Annette may have some also addition to those comments.
Thank you, Governor, and I fully agree with you. Haiti, you know what, as we move towards the new normal, we want to make sure that we move towards a better normal, a normal where we are prepared to ensure our protection, and a normal where we are more prepared to handle any other resurgences or new variants. So I'll ask you, Haiti, when was the last time you caught a cold? Can you tell me?
Long time ago.
Right? You probably had it before we started the masking. And I think this is a very good and practical way to demonstrate the effectiveness of the masks. As a physician who's board certified by the American Board of Preventive Medicine, I will tell you that I personally think the mask should be the last intervention to go, because they work and they protect you not just from COVID, but from the common cold, from the flu, from all of the other respiratory viruses. So when we make the decision to retain or remove certain requirements, our governor and lieutenant governor have always been guided by objective data. They don't go by arbitrary dates or by just the fact that we're all tired. No, they base it on data. And I think that is the way to go if we want our new normal to be a better normal. Over to you, Crystal.
Could I just add something to, when Dr. Berg was talking about possibly in 2 weeks, he may be referring to, like I said, situations where we can maybe lift masking in certain situations. But I will tell you that as long as you are out in public, that mandate of the masking must continue to be adhered to.
Thank you, Governor.
Heidi, do you have a second question? Go ahead.
Yes. Are we officially out of the Omicron surge?
No, we are still surging. Our positive new cases are still pretty high. And so as long as our positive new cases continue to be high, because that's the driver of hospitalization, that's the driver of severity of illness, we will still be in a surge situation. However, our numbers and our data showing that we are gradually decreasing, and hopefully we will taper off in the low numbers. Maybe one of the doctors can chime in on that, but we are still officially in the search status.
Thank you, Governor.
You're welcome, Heidi.
Thank you, Heidi. Daniel Perez, KUAM, do you have any questions?
Yes, thank you. Thank you, Crystal. Good morning, Governor and everybody else. So I guess my first question would be, President Biden said that he has this new plan to, it's the test to treat initiative. are we looking to implement that here, Governor?
What did, I didn't hear it. What did President Biden have?
The test to treats initiative, are we planning on implementing that here on island?
Actually, that's part of that plan is what also Dr. David had presented with the CDC guidelines. So we have always been guided with CDC guidelines. We have always been guided with what President Biden, and even before President Biden, President Trump, he put out an America's plan for the COVID, and we looked at that, and we actually tailored our plan to that plan. And as a result, that's how we got to PCOR 1, PCOR 2, PCOR 3 metrics. And so this plan that President Biden has put forward, we've already implemented a lot of those in the plan. You know, he talks about being access to testing. He talks about vaccination. He talks about boosting. He talked about treating. Every modality of that plan we have already implemented. And that's why we are where we are today. As you know, and I cannot overemphasize this, we have been made, we were fortunate and very, I think, again, fortunate that we were able to quickly vaccinate our people and to quickly treat our people with the advanced treatment modalities that CDC and science has put forward. We have tested people, and we've tested people for free. We've vaccinated people for free. We've treated people for free. You know, I think our community, and as a Pacific Island, we are greatly appreciative for the help of our U.S. federal partners, our federal agencies, FEMA, CDC, public health experts, people that have come out, the Guam National Guard, and so forth. So, you know, Daniel, I just have to say that I am very proud with all the work that our team has done. I am very proud with the resourcefulness of our team. I'm very proud with the innovation and the, hey, our ability to adjust quickly. Like, who would think that the Manilo Senior Center is a treatment modality center for our virus, COVID-19? You know, that's innovation from our team and of the community support. So I think I would like to say we are way ahead of President Biden's plan. We've done all those things first. I think Fernando has a comment too.
Yeah.
Yes, ma'am. Thank you for
Governor
that.
Fernando,
Yes.
if I may, Governor, if I may.
Sure,
I just
sorry,
wanna-
Art.
No, no problem. I didn't raise my hand on the icon, but I do want to just chime in that yes, this test to treat is, as the governor has said, even going back when CDC said, take your mask off, the governor and the team was very wise not to do that. And we continue to maintain mask mandate. Now with the test to treat, the governor is right on spot. We had the testing over at the Teason site, started with Dr. Lewis Cruz, transitioned over to Dr. Bob, and that test to treat approach is definitely in practice here in Guam, and steps ahead, as the governor said. So I just wanted to thank Dr. Cruz, Lewis Cruz, Dr. Bob, Fernando, and the team there at the test site, the MAB site. Oh, as governor said, over in the Manila Senior Citizen Center, that is our current site for treatment, and that's when we had our first MAB site. So, you know, kudos to the people that are working alongside public health, my team, and all our partners, the governor, lieutenant governor, PAG, Surgeon Cell. There's so many members on this team, and we meet in the mornings, and we come up with different plans and strategies, and definitely very, very forward-thinking folks. So thank you all for the team that make the team. So thank you. Fernando, to you, of course.
Thank you, Director. And so, Daniel, knowing what they mean by test to treat, the issue that they've been having in the mainland was there's a certain time frame from when somebody tests positive to receive the maximum benefit of monoclonal antibodies. With the REGEN-COV, that was 10 days. Now they're seeing it's 10 days, and with the 7 days, and with the antiviral, that's down to 5 days. And what they were seeing was that was an issue because they could not get somebody into treatment quick enough to where it was effective. Now, we, as stated by the governor and director, we identified through our own data and our own means and analysis the test to treat strategy, and we implemented it back during the Delta surge. I want to say we came up with the plan in August, executed it fully. It was in full swing in September. And what we did was actually we got it down to an average of 48 hours. We got people into treatment, if not quicker, but no more than 48 hours from the time they were identified to identified during testing. And so, you know, in a lot of ways, we really were leading the pack in terms of test to treat. Oftentimes, they reached out to Guam. Other jurisdictions reached out to Guam to provide information and assistance in how they can improve their test to treatment time. So, you know, it's not about are we going to implement it? It's they're just catching up to us in terms of implementation. There's always ways we can improve it, but test to treat was really developed understanding how we deal with other diseases, right? And other illnesses. You have to, one, identify the illness and the issue. And from a medical perspective, you have to provide the proper treatment. And so all we did was take that and apply it as part of our overall COVID response. And so I'll go ahead and turn it over to Dr. Bob if you have more to add.
Yeah, I just wanted to reiterate what the governor, what the director and Fernando has been saying about what happens is my wife, we've been going a couple times off island for medical, and we've been seeing an oncologist. And when I talk to them about how we're doing our treatment modalities, they're quite impressed. And this is UCLA, okay? They were quite impressed in how fast we were able to do stuff that we were able to do. And I think I wasn't too sure, but I think it was you were asking, will these treatment with the sotrovimab, did that diminish our improve our statistics? And I said, I don't know, because I don't have a crystal ball. But to the answer to that question now, I think a lot of the reasons why our hospitalization rates and our death rates have dropped is because we try to get these people in to get their monoclonal antibody treatments as fast and as quickly as possible when we have it. I mean, again, at UCLA, they were kind of impressed in how fast, because they knew I was a doctor, and they would ask me, and I would just tell them, we try to get people in as quickly as possible. I mean, it's real hard in the States. So I guess lucky you live in Guam. Thank you.
Thank you so much. Governor, I guess my next question for you is there any changes for the interscholastic sports? Like, do they still need to be vaccinated or show proof of a negative COVID test?
No, we lifted that actually along with our EO when we lifted the requirement for proof of vaccination. And so we were just discussing this, Daniel, this morning, and we are going to circle back with public health going out again to reminding interscholastic organizations and also the schools about the guidelines. So we're not requiring proof of vaccination, and Art will probably add to that.
Thank you, Governor. Yes, and Daniel. So I already spoke with Tom Nadeau. He's the Chief for Environmental Health, and he and his team are the leads with regards to the formulation of the guidelines. So he will be reaching out to the private, public, charter schools and to have a Zoom meeting. And I'll ask him to also include the interscholastic organizations. And it's really just to go over the guidance, to discuss with them in a conversation-like manner what the guidance presents, that it is just the guidance. It is the guide in terms of what is expected to be maintained. Now, some of the concerns raised was, well, some of the schools are increasing the guidelines or the requirements. That's at the discretion of a private school to do so. And of course, we're not here to say don't do that. We're here to say this is what the public health guidance is. Like establishments, private establishments want to continue doing a vaccine check. It's not required, as the governor has already issued that. But if an establishment says they want to do it, that would be the private establishment's decision to make. And so I just want to share that with you, that we're having a meeting is being planned for tomorrow with the schools, the GDOE, our private and our charter schools tomorrow in the afternoon. Time hasn't yet been set, but that is already being worked on, just to provide that conversation with our schools and interscholastic organizations.
And so to reiterate, Daniel, if the interscholastic organizations want to require proof of vaccination, although public health guidelines does not require that, that is on their own. So it's not that we are requiring it as a public health guideline.
Thank you so much, Governor and Director. So I guess for my last question, Governor, for you is there's a recent video that shows you dancing on stage with no mask. And so how would you respond to those people who say that you don't practice what you preach?
I would just say that that's not really an accurate depiction of my practice, what I preach. When you are exercising, guideline says you do not have to wear your mask. That's been from the very beginning. And so dancing on stage with people, yes.
Thank you so much, Governor.
Thank you, Daniel. We'll go on to the next person and come back to you.
Thank you.
Morgan from the Marianas Business Journal.
Half a day. I just have one quick question. So looking towards the future, if we continue on, let's call it our path of good behavior, what is the next step on the easing of restrictions?
Probably the next step would be easing more on the social gathering restrictions. That would probably be the next one, Morgan.
Perfect. Can you give any example of that? Would it be obviously increasing the gathering numbers, but do you have an idea of a number in mind?
Well, if the numbers look really good and maybe in 2 weeks and we look at this, I could possibly, I will discuss with our team, and there may be the possibility of just not even have social gathering limits.
Okay, perfect. Thank you so much, Governor.
Thank you, Morgan. Joe Titano, Pacific Daily News.
Morning, happy Thursday, everybody. A question for, I guess this is for the governor, or maybe public health. You know, this new COVID-19 community level, some federal officials kind of described it as the first step towards a sort of an exit strategy to dealing with the pandemic. I mean, I guess is that, how are we factoring that into how we're thinking about it? Are we looking forward to moving on? And is this a way for us to kind of figure out what the new normal is going to look like? How are we planning for that?
That's exactly how we're planning it, Joe. I think these are really good guidelines to look at because it gives us some sense of data related, science related. But throughout, even President Biden's whole speech also was, how do we get from here to normal life? And he definitely is moving in that direction. I think CDC is moving in that direction. I think all of us are trying to move to that direction. And so as we monitor our numbers and our data every day, we will, like I said, gradually and slowly lift restrictions, monitor it, and see how that action has resulted in our community's risk, and then move forward. I would like to have the day where we don't have to be tested, we don't have to be monitored, but I don't think that's going to happen for quite a while because this COVID virus is going to be with us. Our mode of action also is not about eliminating this virus. It's about how do we create our normal life along with this virus. So Dr. David and I guess Fernando.
Yeah, hi Joe. I think it's very important to remember that the pandemic isn't over yet, although things are better. And so we can't really exit the pandemic until the virus exits us. And these guidance, the community indicators, are really just a way of providing an objective framework, a measurable framework that can guide our actions moving forward. So rather than basing decisions on when to lift certain restrictions on subjective uh, indicators like we're tired of it or we're fatigued, or rather than basing it on that, these guidelines give us a measurable and objective way of deciding when to lift and when to retain certain restrictions. So let's not exit the pandemic before the pandemic exits humanity.
Thank you, Dr. David. Joseph, I would like to also, kind of state that, if you look at the community measurements, Guam, has repeatedly since day one has always placed great emphasis on our hospitalizations. That has always been one of our key metrics, whether the CDC is formally recognizing or not, in terms of how they objectively measure, we've always measured that. And even as we look to transition to living with this virus and having an end in sight, it has been, I can say at least this much, that we are in the middle of the pandemic, and the governor and her team of advisors have always been looking at what is that end goal, whether it was Operation Liberate Guam, and as the virus has mutated, we still constantly try to keep an end goal in sight, to find a way to get us through to some normalcy. And you can see that in the changes that we're making, whether we're cutting back on certain services, whether we're closing down the ISOFAC and converting to an alternative care facility. These are all things that were not just drummed up overnight and that we just moved on. These were plans that were analyzed based on the right time to pull that trigger, and that's always been based on the local data that we have, and also also geared around the particular variant that we were currently dealing with, right? So what you're just seeing are plans that have been made for a while now, a long time ago, actually, sometimes dusted off and then implemented when the time is right to implement. So that's what's happening right now with a lot of these changes that are coming about. So CDC guidelines or not, we've always been analyzing that data. I think it's another point where Guam was really been leading the pack. And I think there's more than enough evidence to support that we've always kind of had it right on those key measurements.
And yeah, just as a way, I guess, for the public to think about, how to look at these new levels, right? Because the CDC does tie some specific recommendations. Like I think at the lowest level, it's basically wear a mask if it's your preference, right? So is that kind of how we should be thinking about this? Check the level, and public health is likewise going to be tailoring their response based on that. I guess sort of the way we were dealing with the course card.
Right, absolutely. And that's how we have been dealing with the pandemic.
And one other thing, I know last week, public health took some time to kind of iron out some of the details and update the Guam pandemic plan. Is that just a coincidence, or is that also another thing where we're kind of looking how to maybe to move forward and to have a ready response as we're kind of looking towards normalcy? I don't know if the director St. Augustine is here, but
I can.
We are always prepared if we have a plan that everyone has contributed into, whether it's the disaster plan, whether it's a pandemic plan, whether it's a typhoon plan. We continuously have to be prepared, and we're prepared through these kinds of plans. And so what we did was we wanted to update the plans to also be very focused on the pandemic, for again, future needs. As you know, Joe, we started this pandemic with really the only guidelines we have is our regular total disaster emergency plan that we had. Nobody knew about this virus. Nobody knew anything about how to respond and so forth, although we had experts that have been in crisis situations and have been in emergency situations and generally have the basic concepts and basic actions, but we couldn't tailor it to this pandemic because there was none. So as we moved along, the greatest benefit of doing this is everyone that has contributed to this plan have had experience with this pandemic. And so I think our plan is very practical. Our plan is very real because as we move along, we incorporate it. What are the good things? We thought about what our mistakes were. We thought about how we improved it. We thought about how we could do better. So it's not a coincidence. It is actually a um, a s- a structured, strategically decided to, hey, let's do this plan while we're right here experiencing this plan or this pandemic.
Thanks for that, Gov. Mr. Esteves, did you have something that you wanted to add to that?
No, I think the governor covered it all. Thanks.
Thank you,
Okay,
Joe. We'll
all
come
right.
back to you for the second round. Roma Khan,
All
Pacific
right.
Island Times. Pacific Island
Hi.
Times. Roma, do you have any
Hello.
questions?
Yes, I do. Thank you. Good morning, everyone. I have a question regarding the strains, COVID-19 strains. So I understand we're still under or in the midst of a Omicron surge. But my understanding is that this virus is actually it continues to evolve and to change, right? Because that's what viruses do. Does Guam have any strategy in terms of detecting new strains, and do they have a strategy as far as dealing with it if it should appear in Guam?
Well, we continuously test and we send off these testings to be sequenced so we can identify if there are other various variants. We also have close network of communication with the World Health Organization, which also monitors the variants. We also have a great communication with CDC, HHS, all the scientific organizations that monitor this, not just nationwide, Aurora, but also throughout the whole world. And so we plan to continue testing. We plan to continue vaccinating. We plan to continue treating. But we also, in that plan, part of it is communicating with the experts nationwide and throughout the world who identify these variants and who monitor. Anyway, I don't know if Dr. David, do you want to add anything from an epidemiological standpoint?
Yeah, everything that the governor said is in fact very accurate, Aurora. And I believe Dr. Ann had recently reported on some of the results of the samples that are sent off island for the genomic sequencing. I think we continue to hope that no new variant arises, right? That is what we are all praying for. And that if any new variant comes up, we pray that it will still be something that the vaccines and the therapeutics can combat and overcome. And the key is really building up that big mass of the big wall of protection that vaccination and boosters can give. So it's important to emphasize, to keep emphasizing the message that if you're not yet vaccinated, get vaccinated. If you're fully vaccinated, get your booster. There is no substitute to that wall of protection for our island community.
Thank you for that. My second question is regarding the metrics, the new metrics that was provided by the CDC. So per your presentation, we are still at medium and high risk as far as the second metric is concerned. And if I understand correctly, the fact that we are on the low risk in the other metric does not detract from the need to continue to be vigilant, right? Because it's the high and medium risks that control.
Absolutely. We are still at high right now. Although when we look at the data, we've been tracking it since Monday, it's been improving. So I think
Okay.
if we continue with the way that we're doing, pretty soon we'll be moving to the moderate. So we keep our fingers crossed that we continue with the current trends. But you're absolutely right. We cannot, I think if there's one lesson that we've learned, right, from this pandemic, we can't let our vigilance go down, because who knows what the next virus is, It's lurking out there. So that vigilance that you mentioned, it's very critical.
Are there additional strategies that the government is mulling in order to, speed up the lowering of our risk as far as those two
Sure,
mechanisms?
our additional strategies to aggressively boost our community,
Okay.
and we are going to have a very aggressive campaign because our boosting population isn't where we would like it to be. And also, we want to make sure that we continue our focus on those age groups and also on those individuals who are vulnerable and who have maybe comorbidity and they're immunosuppressed. So that's our additional strategy. Maybe Dr. Bob, you could add into that also.
Sure. Thank you, Governor. So we continue to, Fernando, you can correct me if I'm wrong, we continue to go to the schools, the elementary schools, to vaccinate the 5 to 11-year-olds. And our plan also is to, get in contact with the mayors to say, this is not just for the 5 to 11-year-olds, this is for their family to come and get either their first vaccines or their booster. So that we try to offer, convenient access for people to get vaccinated. Because again, the more, as Dr. David mentioned, the more layers of protection, the less likely we'll get their spread, the less likely the hospitalization, the less likely the people getting sick and dying. So yeah, we've kind of been lackadaisical, I think, but we're gonna try to improve on that by increasing our availability for people to come and get vaccinated, to continue to increase our vaccination rates. Thank you.
Thank you so much, Roma. Last but not least, PNC, Devin.
Good morning. I wanted to bring up what Governor Lilian Guerrero said about the aggressive campaign. Now, as I understand it, the GOG vaccination clinic is closed and will be moving to GCC. And I wanted to ask first, why the move from UOG to GCC?
But if
Well,
I can.
Fernando, you want to answer that?
Yes, ma'am. Devin, the answer is simple. That's a facility that at one point took 1,500 a day. When we're getting 100 or less, it's not the most effective use of our resources. And so, in plan for that consideration, we've been trending the data based on demand and are trying to reallocate our resources appropriately. And so that's why we're still going to have a central clinic, but it's going to be at a capacity that's going to be more consistent than what the demand is, right? So, if we're seeing about 100, 150 a day, we're going to look at a clinic that could do about 300 a day very easily. And so then that way we can direct those resources elsewhere. But to answer your question in a simple way, there just wasn't enough people coming out.
Thank you. In regards to the governor's statement about an aggressive campaign, can you explain more about what kind of campaign we'll be seeing with the aggression that you described?
It's really going to be outreach and reaching out to especially underserved communities that may not have access via transportation or other means, or lacking in information. And so working with community partners through whether it's religious organizations, cultural organizations, nonprofit groups, to try to kind of address these and find a way to get them vaccinated. As we've seen with Operation Homebound, who vaccinated over 300 in the time that they've been doing. We have to understand that there are different areas and targets, right? And the metrics that we use in terms of how we measure success are different, right? So we've done the mass vaccination, people who have the means to come out. We've done that for well over a year at this point. Now it's those individuals who have a very hard time coming out to us that we need to expend resources in a different way, and approach it a different way to try to get to them and provide the vaccination should they want. The other thing we also have to balance is that there are people out there that just, no matter what you do, just have no interest in getting vaccinated. So it's a different strategy, I will say, and there are different challenges associated with that.
Thank you. Now, you mentioned that there are some people, you just mentioned that there are some people that are that just refuse to be vaccinated or receive any kind of treatment to this. Is that population concerning, and is the population great enough where it's concerning that these certain people that refuse to be vaccinated are not getting vaccinated, and does that pose a threat to everybody else?
That it really does depend on I'm sure Dr. David would like to chime in on this, but it really does depend on the situation, right? The real unique, well, I don't want to say unique thing, but the difficult thing that's been with COVID is that the different variants that we've had really look like different viruses, right? Whether it's towards severity or transmissibility, and they operate differently. And so that vaccination number that we need is really dependent on what the situation is here locally, right? If, we were talking about, let's say, the alpha variant or the ancestral strain, then, I can say without a doubt, absolutely not. The number of unvaccinated really doesn't make any difference because the threshold was much lower. But with some of the variants that we've seen come out recently, Delta and Omicron, that has, unfortunately, that target has changed, more consistent with that variant. But I'll let Dr. David chime in on that a bit more. I'm sure she has.
Right. We have in healthcare the principle of autonomy, right? So if a person, knowing all the information, chooses not to get an intervention, then we can't force them to do that, right? We have to respect their decision. Having said that, again, if you think about vaccination as the wall that is our protection for our community, every unvaccinated person is a weakness in the wall. Every unvaccinated person is a crack in that wall, which what that implies is if a new variant should come up, it will get into our community through the weakness in the wall, through the most susceptible, which would be the unvaccinated. So that's the reality of it. And so we hope that the rest of us who have gotten vaccinated and gotten boosted will be able to strengthen that wall sufficiently to protect even those who are unvaccinated. But the reality is the way viruses and pathogens work, they will look for the most susceptible in a population. So that becomes a weakness going into the future.
Thank you so much, Devin. We'll come back around. Guam Daily Post, Heidi, do you have any outstanding questions?
Yes, for the governor. Governor, when will you end the public health state of emergency designation, given that there's ample accessibility to the vaccines and there are effective treatments? Is one of the main considerations for this emergency declaration the availability of federal funds? And without this emergency declaration, would you still be able to access COVID-19 federal funds?
We will continue to be in a public health emergency as long as we feel that we are not out of the woods yet. The public health emergency, what it does, it allows us to quickly access all those resources that you've just said. I believe some of the federal assistance that's been given is not contingent on a public health emergency declaration, but like, for example, the deployment of the National Guard and the paying of the National Guard by the federal government at 100% is under a public health emergency declaration. So there are some situations, but for the most part and the overall part is having declared a public health emergency gives us the flexibility and the quick response opportunities to access resources to help with the response and to help with the protection of our people and even with our economic recovery that we are, of course, doing. So I hope that answers your questions, Heidi. I know Dr. Bob and Fernando may have something to add.
The thing that I wanted to add was that some of the treatment modalities, the vaccinations, are dependent on having a public health emergency because they're EUA. If we stop the public health emergency, we can still give the Pfizer because it's full authorization, but the other vaccines, the monoclonal antibodies are dependent on us being in a public health emergency. And Fernando, you can correct me if I'm wrong on that one, but I think our public health emergency allows us to be able to use those treatment modalities. Thank you.
Yeah, exactly what Dr. Bob was saying. Those are all concerns with the public health emergency. The other thing operationally is that the assistance provided by other paraprofessionals in terms of healthcare, EMTs, CNAs, MAs, kind of working a little bit under supervision, but an extension of their scope, whether that's vaccination and swabbing, all of that goes away. And I'll tell you right now, based on the current situation, we don't have enough nurses on the island to support the functions that we're supporting right now for the community, whether that's testing at all of these different sites, whether that's vaccination outreaches, without these nursing extenders. And all of that goes away with the public health emergency because the powers that grants them the ability to extend a little bit outside of their scope under proper supervision is all under the Emergency Health Powers Act. So, I don't want to jump in, but I think that's very short-sighted to think that it's about funding. There are much more important implications to that emergency that affect kind of our day-to-day operations that we're more focused on than the bottom dollar, honestly.
Thank you so much. I have another question. Are government employees in the executive branch still mandated to undergo the weekly testing if they are not vaccinated? And do you have the latest on the full vaccination rate in the executive branch? And of those, how many took the booster shot?
Right. I don't have the booster information, but I think my last information in government employees rate is about maybe 93, 94%. And so it may be higher now. We have not yet lifted the mandate for vaccination and testing on government employees.
Thank you, Heidi. Next, KUM Daniel Perez.
Thank you, Crystal. My question is actually for Dr. Bob or Dr. Annette David. So there's a study that shows that the COVID vaccine for children are less effective against the Omicron variant, but the booster does help. Can you guys just sort of expand more on this study?
So most of the vaccines actually with the Omicron don't work as well. And I think the study on that they did on the kids was mostly the Omicron variant. But if you really looked into what they said, yes, it was the vaccinations antibodies were lower, but it still improved the chances of not getting severe infection. And I don't know if you remember, but about 6 or 8 months ago, we had a rush of MIS kids, and those were people that were in the 5 to 11-year-old range. And so there's another study that will show that showed that kids that are vaccinated are at lower risk of getting MIS-C. So it does not work as well, but in the fact that the antibody levels may not be as high, but it does help protect against severity of the disease. And that's the main thing you want to see. You don't want people getting hospitalized, and you don't want people dying. So that's where the vaccinations continue to help the communities, is lower that risk. Thank you.
Thank you so much, Dr. Bob. And for my last question is Operation Homebound over, or is it still ongoing as of now?
It's ongoing, though, we are looking at scaling down, right? And then doing more outreaches, kind of targeted and focused, working with community groups. But, on that note, Operation Homebound has far exceeded what we had initially expected or set out as a target goal. And so with that, they are ahead. Now, we're going to maintain the momentum, but we have to consider the personnel, right? Going 6-7 days a week is not sustainable. So as we transition to living with this virus, that's also going to include being able to have sustainable operations, to where people are able to recover physically and mentally. And so we're just going to be balancing that. So we will continue the outreaches. We're still in the planning stages for that, of what Operation Homebound more specifically going to look like in the coming weeks.
I think Operation Homebound is going to evolve to a much more permanent program under the public health because of its positive results, I think, in community outreach and in targeting the much more vulnerable population. Yeah.
Thank you, Daniel.
Thank you, Governor.
Morgan, MPJ?
Half a day. There are no other questions for me. Thank you, guys.
Thank you, Morgan. Joe Titano, PDN?
Yeah, we've been kind of talking about a while for possibly a local program to provide free at-home tests for residents. Is that something that we're going through? Has there been any progress towards that?
Yeah, I'm still working on that, Joe. I'll report progress once it's there, but that still fully intend to do that, to close the gaps on the at-home testing for the program. So those with multi-generational homes, I'm still working on that. I'll provide an update once we have more. But in terms of community testing, there's definitely availability there. We still have a lot of testing available for the general community, but we do want to make it more convenient by providing that home test kit. So more to follow on that. But thank you for staying remembering.
I appreciate it. And I believe that the fourth dose of the vaccine is also now available. The fourth, I guess it's not a booster. Fourth dose is available for the immunocompromised. Is that something that we're making available right now?
So standing order has been signed since as of yesterday. So for those that are immunocompromised, the fourth dose, which is the booster dose for that population, is now available. The difference was that the immunocompromised, they needed to get 3 doses to be equivalent to those that are not immunocompromised with 2 doses. So yeah, the booster dose is now being instituted, and they're standing order. So the nurses at the different clinics can start giving it. Thank you.
All right,
Thank
thanks
you,
for that,
Joe.
Dr. Bob.
Devin, PNC?
Yes, so I wanted to address the isolation facility. Now, I know that it moved from, or the Bayview Hotel is now closed, and it will move to the Garden Court in Tuma. Now, I wanted to ask, what are the differences? Excuse me, I'm sorry. What are the differences in placement for those requesting for government isolation between the isolation facility and alternate lodging facility?
Yeah. So the key with the isolation facility, Devin, is that once someone was put into the isolation facility, they were under government watch, right? So they couldn't leave voluntarily. They were involuntarily isolated there at their choosing. So they in essence become a ward of the state. So we had to provide every single service for them, right? Whether that be internet, whether that be food, medical. With the alternate care facility, what we're providing is a physical space for people to self-isolate. So individuals who really don't have the means, particularly in the underserved populations who just don't have the physical capacity to be able to isolate properly, we want to be able to still offer them a space in that facility, but they do have to be self-sufficient. So while food is still provided, other services are no longer provided, right? We're not going to be manning it. It's basically a physical space. It's a hotel room for them to isolate themselves, just as they would if they were able to at home. And so that's all we're providing.
Okay, thank you very much. I think that wraps up all the questions that I have.
Thank you, media partners. We've gone through 2 rounds of questions. If there are any, that last call for any last questions.
Crystal, for public health, do you have an estimate of the number of employees you were able to hire since the pandemic started, and how much in additional payroll costs are we talking about? Or are you still tracking these numbers?
I don't have the totals on me. I mean, I can say at least during my time and from the job fair, I can say 43 out of the 73 we were looking to hire were hired. But I haven't had an update recently on that. In terms of payroll costs, those hires were under COVID-19 federal grants. So they were not hired under local funds, particularly for the COVID hires. So those are all covered federally.
Thank you, Heidi. Any other questions from any other reporters before we end today's media briefing?
Yes, I actually have one last. It's still about Operation Homebound. So aside from all other areas that were covered, like Tangisan and all the other places where there's homeless people, what other areas has the team also been deployed to?
Well, keep in mind, Daniel, you have to understand we use the technical definition of homeless, right? These are not just, outside communities. Homeless also talks about individuals who are in substandard homes, right? So we visited some community areas, Swamp Road, Gilbaza, Zero Down, even some smaller communities. But what we're really looking to do and kind of the next evolution and iteration of that are some of these areas that are not even on the map, right? You're not going to have communities. You're going to have a house that's in the middle of a jungle that nobody would know is there unless they've been there. And so these are the challenges that we're going to have to meet and try to reach out to these folks